mynews.studio.
In just 10 years, we've watched a disease that used to threaten hundreds of millions shrink to a fraction. It makes you wonder, could infectious blindness really disappear within a single generation?
So, today's date is February 20th, 2026. There's a real milestone here. The risk of trachoma, which is still the leading infectious cause of blindness, has fallen by 94%. Back in 2002, 1.5 billion people were at risk. Now, it's around 97 million. What's behind such a dramatic decline?
It all centers on the SAFE strategy. That stands for surgery, antibiotics, facial cleanliness, and environmental improvement. But it's not as simple as ticking boxes. Take Ethiopia, for example. The country still accounts for 64% of the world's trachoma burden, about 66 million people living in endemic areas. The approach there is very specific. Last year, 72% of all global surgeries for advanced trachoma happened in Ethiopia. And there's a real focus on reaching women, since they make up about 70% of those affected.
Wait, why are women so much more affected?
It mostly comes down to childcare. Women are usually the ones taking care of young children, and kids are the main source of the infection. Having gender disaggregated data has really changed things. Programs are now designed to make sure women have equal access, not just to surgery, but also antibiotics.
That's a huge logistical job. How do they actually get antibiotics to everyone who needs them?
Mass Drug Administration, or MDA, is at the heart of it. In 2024, Ethiopia alone handled 73% of all global antibiotic distributions. Most of the antibiotics are azithromycin, donated by Pfizer. These campaigns are part of local health services, which means people in even the most remote areas can get repeated and consistent access.
And the environmental piece. How do you actually shift hygiene behaviors or sanitation in places where that's a challenge, like rural or pastoralist communities?
That's where partnerships with WASH programs come in. These are water, sanitation, and hygiene initiatives. They work directly in villages, teaching about face washing, upgrading water sources, and tackling flies, which spread the disease. Plus, they use smartphone-based surveys, like the Tropical Data Platform, to target efforts where they're most needed.
You mentioned pharmaceutical donations earlier. How critical are those, especially now as we get closer to elimination?
They've been essential. Pfizer's International Trachoma Initiative has given over 1.1 billion doses of azithromycin since the start. Just last year, 46.7 million doses reached more than 44 million people. By 2030, the value of these medicines could add up to about $2.2 billion.
But as we get closer to the goal, isn't there a risk that support could drop off? What happens if funding or drug access slows down?
That's already a concern. When numbers fall, attention and funding sometimes fade too. The International Coalition for Trachoma Control has warned about gaps, especially for surgeries, drug campaigns, ongoing surveys, and research. The worry is that if donors shift focus too soon, progress could stall.
How are local health workers and communities involved in all this? Are there lessons here that could help tackle other diseases?
Local involvement is absolutely key. Ministries train health workers to do eye surgeries and handle antibiotic distribution. In Libya, for instance, local teams led the surveillance after drug campaigns, going door to door to check that trachoma rates stayed low. Digital tools, like the Global Trachoma Mapping Project and Tropical Data, have given local teams ownership of data and monitoring, which makes the whole process more accountable and targeted. Some of the big takeaways have been to prioritize gender equity, link health and sanitation, and build systems that can keep running during tough times.
So, eliminating trachoma doesn't just mean preventing blindness. There's an impact that goes beyond health, right?
Exactly. Preventing blindness lets more children stay in school, more adults keep working, and families avoid the economic and social strain of disability. It really changes the trajectory for whole communities, raising productivity, boosting inclusion, and giving people hope.
And it's not a one-off. By 2025, 59 countries have eliminated at least one neglected tropical disease. This model, driven by communities, guided by data, and built on partnerships, clearly works.
It's become a framework for facing down other diseases that affect the world's poorest. The Trachoma effort is proof that global health cooperation can really deliver if the commitment lasts until the very end.
So, are we on track for global elimination by 2030?
If momentum stays strong, if funding, political backing, and community effort continue, then yes, it's possible. But the last part is often the toughest.
It's a huge turnaround when you think about it. From 1.5 billion people at risk to being right on the edge of elimination.
It really shows what's possible when science, policy, and local action all line up to solve a problem.
That wraps up today's episode. A global fight against blindness, nearly won, but still needing that final push.
Thank you for joining us. This isn't just a story about medicine. It's about what can happen when people and partnerships persist.
Thanks for listening. This episode was brought to you by mynews.studio. You can try it now for free.